In this video, I will explain how you can quickly get an idea in EMDR therapy what your client's underlying presenting difficulty is. Please join me. I'm Dr. Michael Paterson, clinical psychologist and EMDR Europe accredited senior trainer. I've been working with EMDR therapy from 1998 and have seen many clients over the years. Whenever they present with a particular difficulty in the here and now, I'm trying to understand what might be underlying that. I'm listening within the first few moments of a client's arrival to what that difficulty is and getting a feel from there what may be the cause of it, what may have happened in the past that has led to them having this difficulty in the here and now. After the client is settled and I've introduced myself and check that it's okay to call them by their first name, I ask, what's the reason you come to see me? And in that particular moment, I'm listening for what the client is saying. For example, the client who's sitting in front of me is saying, I've been really stressed at work. More and more work keeps coming my way and it piles up and piles up. And I can't say no. At that point, well, we don't know what has happened in the client's life. We know nothing about their history. But when I'm hearing, I can't say no, I'm thinking, what meaning might this have for the client? If you just take a moment and think, if you were that particular person, somebody wants you to take something on, but you realize you've got so much to deal with, and to take something else on, it could be overwhelming, but you still take it on. What might be the reason that you're not refusing to take it on or asking for the boss who's giving this to you to take something else off you so you can do that task? What I'm trying to do is form a hypothesis at that particular time to get an understanding of what might be going on for the client. In that circumstance, I might be thinking the client can't say no because they don't want to disappoint the boss. If they do say no, what would that say about them as a person? It might mean I'm not good enough. So I'm thinking at this stage, what has happened in the past that has led to this client having the difficulty in the here and now? And as the client is speaking about that current difficulty, I would be asking about other scenarios and gauging the client's response, looking for their emotional response as they're talking about it. If it appears to me that the client is reasonably well contained, speaking about their experience, I'm getting an idea where the client would be on a continuum of complexity, from the well-adjusted here to the most complex client presentation here. If the client is from about here to about here on this continuum of complexity, I would consider using the float back technique to identify what the earlier experiences are that have created the difficulties for the client in the here and now. I would invite my client to think of a recent example of having been asked to take on another task, which they've done, bringing up the picture that represents it, getting that negative self-belief, in this case, I'm not good enough. Perhaps that would help confirm my hypothesis. The emotion that's being stirred, and where do you feel it in your body? So thinking of those words, I'm not good enough, that feeling in the body, and that emotion, holding them together and floating back in your memory without searching for anything in particular. Just allow your mind to float back to any earlier memory or memories that come to mind. And as the client floats back, we're noting down what those past memories are. Now we've got our touchstone memory and a number of other past events. We still don't know if there are other experiences that the client hasn't connected to. We need to take a detailed history, starting from mother's pregnancy with our client, and moving right forward to the present day. If you are a clinical psychologist, counselling psychologist, psychiatrist or forensic psychologist or mental health nurse, then you will be taking a detailed mental health history. That's brilliant. If up until now, working with EMDR therapy, you haven't bothered with a detailed history, it's important that you do take that. There is another video in my series of taking that history and the sort of things that you could ask in that. What we're wanting to do is identify the past events with the touchstone memory and other past experiences identified through the flowback and through that detailed history. We also want to identify those present triggers and the client's desired outcomes for the future. So in summary, what we're doing initially is forming a hypothesis as to what the client's presenting issue is. And then we're thinking what has happened in the past that has led to the client having this difficulty in the here and now. The information that we gather from the floatback and from the history will either support the hypothesis or lead to us rejecting it. Once we have our hypothesis and the hypothesis is supported, then we can develop our target treatment plan, starting with the past events, then the present triggers, and then the client's desired outcomes for the future. I hope this video has been of benefit to you. If it has, please click like down below. If you haven't already subscribed to the YouTube channel, please do so. It means that YouTube can let you know if other videos in the series come online. I want to help you become the best you can possibly be in delivering EMDR therapy.